Welcome to the PrepNet, presented every Sunday at 6 p.m. Eastern Time on Talk2Me's Channel 14. Come join us to discuss everything about prepping and hear what others have done. Medical Preparedness for Preppers, Part 1. Supplies, equipment, training, and building a capable medical team. Disclaimer. Please be aware that this series on medical preparedness may include topics or descriptions that some listeners may find uncomfortable. This presentation is for educational and preparedness purposes only and is not medical advice. We will not go into graphic detail, but we will mention topics and areas you may want to research further as part of your own preparedness planning. Medical procedures should only be performed by properly trained individuals operating within their level of knowledge, skill, and legal authority. In a real emergency, seek professional medical care whenever possible. One of the most overlooked realities of emergency preparedness is that injuries, illness, and medical emergencies do not stop during disasters. In fact, they often become more common. A power outage, severe storm, wildfire, civil unrest, pandemic, supply chain collapse, or long-term grid failure can turn even a minor injury into a life-threatening problem. Many people spend large amounts of money on food, water, generators, and firearms, but have only a tiny first aid kit and almost no medical training. In a true emergency, the ability to stop bleeding, prevent infection, manage pain, stabilize injuries, or care for sick family members may become more valuable than almost any other preparedness skill, and is as important as what we discussed in our sanitation topic. Medical preparedness is not just about buying supplies. It involves training, planning, sanitation, communication, organization, and building relationships with medically skilled people before an emergency happens. Because this is a large and important topic, we will cover it over multiple presentations, starting with foundational first aid skills and supplies before moving into more advanced medical preparedness topics. We will discuss basic first aid supplies and skills, advanced first aid and trauma preparedness, higher-level medical equipment and training, long-term care considerations, medical planning for groups and communities, and the importance of having trained medical personnel in your preparedness group. Preparedness medical care is different from normal day-to-day health care. Under normal conditions, an ambulance may arrive in minutes, emergency rooms are available, pharmacies are stocked, and hospitals have specialists, laboratory testing, imaging equipment, oxygen systems, and large staffs. During a disaster, those systems may become overloaded or unavailable. You may have to care for injuries longer than normal, treat problems before professional help arrives, manage illness when pharmacies are closed, handle sanitation problems, care for elderly, disabled, or chronically ill people, make difficult decisions with limited supplies, and prevent small problems from becoming severe. Preparedness medicine focuses heavily on prevention, stabilization, and buying time. The best medical emergency is the one that never happens. The most effective medical preparedness tool is reducing the chance of injury or illness in the first place. Many emergency injuries come from falls, chainsaw accidents, exposure to heat or cold, axe and knife injuries, vehicle accidents, carbon monoxide poisoning, dehydration, food contamination, poor sanitation, improper firearm handling, and exhaustion and overwork. Basic prevention measures include wearing protective equipment, using gloves and eye protection, maintaining sanitation, keeping work areas clean, having good lighting, practicing firearm safety, using proper lifting techniques, staying hydrated, maintaining physical fitness, and getting enough sleep. Good hygiene alone can prevent massive numbers of illnesses. Historically, poor sanitation and disease have killed more people during disasters and wars than combat itself. Medical gear without training can create a false sense of security. A person with advanced equipment but no knowledge may panic or misuse supplies during a crisis. Even basic training dramatically improves outcomes. At minimum, every prepper should consider basic first aid, CPR, bleeding control, automated external defibrillator, or AED, awareness, burn treatment, splinting injuries, recognizing shock, recognizing strokes and heart attacks, treating dehydration, and basic sanitation practices. Hands-on training matters. Reading about tourniquets is not the same as applying one under stress. Watching videos about CPR is not the same as practicing compressions. Skills degrade over time, so regular refresher training is important. Let's start with part 1 of the basic first aid supplies topic, where we will begin with foundational skills and supplies before gradually moving into more advanced preparedness topics later in the series. Every household, vehicle, and bug-out bag should contain a basic first aid kit. Basic first aid kits are designed to handle common injuries and stabilize problems until additional care is available. A well-rounded basic kit may include adhesive bandages in multiple sizes, gauze pads, rolled gauze, medical tape, elastic bandages, antiseptic wipes, antibiotic ointment, burn gel or burn dressings, tweezers, small scissors, instant cold packs, gloves, CPR face shield, thermometer, eye wash solution, finger splints, triangular bandages, pain relievers, antidiarrheal medication, antihistamines, oral rehydration salts, hand sanitizer, and soap. You should also maintain spare prescription medications, spare eyeglasses, denture supplies, hearing aid batteries, mobility aids, and medical records and medication lists. Medical kits should be inspected regularly because medications expire, adhesives dry out, batteries die, and sterile packaging can become damaged. Storing supplies in cool, dry conditions and using sealed plastic bags or vacuum-sealed packaging may help protect some adhesive items from moisture and humidity and extend their usable life. Organization becomes critical during emergencies. A giant box filled with random supplies wastes time and increases stress. Medical gear should be clearly labeled, waterproofed when possible, stored by category, easy to access, and portable if evacuation becomes necessary. Some people organize supplies into categories such as bleeding control, medications, burns, airway management, hygiene, dental care, trauma supplies, diagnostic tools, and long-term care supplies. Color coding and labeling can help less experienced people quickly locate supplies during emergencies. Next week, we'll continue with part 2 of medical preparedness for preppers. If you have any questions about what we have discussed here or anything about prepping, send your question to prepnetch14@gmail.com and enter question in the subject line.